Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's good, people? This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to officially welcome you to episode 51 of the Ask Dr. Angela podcast. I have to say, it's beginning to look a lot like Christmas. Although, if I'm going to be really honest with you, it was looking a lot like Christmas way back in October. I saw people, stores, everybody or lots of people with Christmas decorations up. Even then, even in my own subdivision, I feel like we were the last folks on the block to get our Christmas decorations up. And we got them up the weekend after Thanksgiving. Wow. Anyway, let's jump right into today's topic. I recently did a piece for a female publication, imagine that, and they asked me to comment on what changes occur with your vagina post-pregnancy, the good, the bad, and the ugly. First of all, what good things happen to the vagina post-delivery? You did just probably end up pushing out a 6, 7, 8, 9, 10 or 11 pound baby in some cases. So the vagina probably is not going to be doing all that great, right? First thing that I mentioned was that vaginas are such rock stars. Yes, as that old Energizer commercial goes, the vagina takes a licking and keeps on ticking. Again, even after pushing out a 6, 7, 10 pound baby, vaginas are pretty much able to return to their pre-pregnancy form. The operative phrase there being pretty much. The only difference post-delivery is that you might notice that the opening of the vagina is a little bit wider than it used to be. All things considering, I don't think that's too bad. Another interesting thing that you might notice with vagina post-pregnancy is a little bit of what we call prolapse, whether it be the uterus having dropped somewhat or the anterior and posterior walls of the vagina may have dropped a little bit. Considering all the pushing that's involved in delivering a baby, that is if you did deliver vaginally, if you also consider the weight of the baby, these things clinically usually will manifest as feeling some kind of pelvic pressure and maybe some leaking of urine. All things considering, your vaginal and pelvic muscles get a hell of a workout through the entire delivery process. This is nothing that a few Kegel exercises, time, patience won't handle, so don't flip out just yet. Something else that you may notice post-pregnancy with regards to your vagina is that you've lost that loving feeling. Wasn't that a song like Hall & Oates? You've lost that loving feeling. I think that was Hall & Oates, right? Anyway, no worries. Everything's going to go back to normal. Our usual recommendation to patients is that you wait until at least 6 weeks postpartum before you start having sex again. Once you've been given the green light, I typically encourage my patients to make sure that you're using a heavy lubricant for the first couple of weeks of intercourse because it is not going to feel that great. To be totally frank, it's going to hurt like all get out. This might be worse for my breastfeeding moms, specifically since breastfeeding puts the vagina in a hypoestrogenic state. I'm going to say that again, low estrogen state in the vaginas of moms that are breastfeeding. Breastfeeding kind of exacerbates that. Not to fear, however, you will once again enjoy sex. Just remember to use a heavy lubricant. And as one of my, I don't know if it was a patient or just someone that I randomly was speaking to, encouraged, you might also want to have a glass of wine. As I previously mentioned, vaginas being able to take a licking and keep on ticking. The healing process is usually about 6 to 8 weeks, specifically if you've undergone a vaginal delivery. And certainly if you had any kind of laceration, tear, or even an episiotomy, it usually is going to take the stitches about 6 to 8 weeks to dissolve. For those of you that are experiencing pain with urination due to the urine hitting that previously mentioned wound, urinating in a bathtub or pouring warm water over the area while urinating might help with the pain. The bleeding and discharge that's commonly referred to as lochia post-delivery can typically last from 6 to 8 weeks. So just make sure that you're wearing a panty liner because, just when you think it's gone, boom, it's back. My general rule of thumb is that as long as the bleeding isn't excessive or the discharge isn't foul-smelling or causing itching or burning, it's usually par for the course. These are just a few of the changes that came to mind when I was asked about what kind of changes vaginas go through post-pregnancy. So hopefully you have found this information to be somewhat informative or maybe even helpful. Thank you so much for tuning in to today's episode of the Ask Dr. Angela podcast. If there is a topic or a question that you would like addressed, please submit it. Go to www.askdrangela, that's AskDrangela.com. Click on the microphone on the right-hand side of the page and do what you do. For those of you that would like to submit your queries via email, I can be reached at angela@askdrangela.com. And of course, you can reach me on Facebook, Ask Dr. Angela, or on Twitter at Dr. Angela OBGYN. If we do use your question or idea on the podcast, we will certainly send you one of our bomb-ass t-shirts. I've got to say, I've been just over the moon excited with those of you that have been posting pictures of yourselves wearing the Ask Dr. Angela t-shirts. Keep them coming. I really appreciate all the love and the support. In closing, I'd like to leave you with this Chinese proverb. When the winds of change blow, some people build walls and others build windmills. Until next time, look better, feel better, be better. Looking forward to reconnecting with you on episode 52 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.